Hello, everyone, and thank you very much for this invitation to participate to the very interesting panel about the debate, basically, in tobacco harm reduction. My presentation is going to be about this debate, which unfortunately sometimes has nothing to do with science. So my conflict of interest, I have nothing to declare for the past 5 years, and relevant to COVID, since the debate is going to be about COVID and my research on COVID-19. I currently participate in a patent application for cholinergic agonists, medications used, potentially used to treat or prevent COVID-19, monoclonal antibodies and diagnostic tests for COVID-19. Now, the debate on harm reduction is basically being done in two fields. One is in the scientific domain, and it's happening through scientific publications. And the other is, unfortunately, through attempts to discredit scientists based on either true or imaginary conflicts, but without any reference, without any real criticism on the study content. This has been done usually in the media, sometimes in websites of organizations which are called tobacco control organizations. But unfortunately, we now have a third field of the debate, which is quite disturbing and quite concerning, which is using the scientific domain in order to discredit scientists without even challenging research accuracy or content. And this is what happened recently. Now, the role of Bloomberg in all this. We know pretty well that Bloomberg has an anti-tobacco harm reduction agenda. There's no doubt. It has invested millions, the Bloomberg Foundation has invested millions in efforts to discredit scientists. I couldn't find, in reality, any real criticism concerning the research content, whether it's accurate or inaccurate, whether there are methodological issues, something in the analysis, something in the presentation of the results. I wasn't able to find anything, although I can't deny that there may be something out there, but I couldn't find it. There are several organizations which are receiving funding from the Bloomberg Foundation and the Bloomberg Philanthropies, but usually they present zero scientific evidence on what they do. It's basically activism based on criticism about conflicts, potential conflicts, either true or imaginary conflicts, unfortunately. And I have been targeted by the Bloomberg Philanthropies. I have received several emails from journalists or from the Bloomberg media. I would consider them a harassment because they come up again and again with emails asking the same questions about conflicts which I have already answered and explained. These are just two recent examples of articles in the Bloomberg media where I was featured. In one of them, I was accused for debunking studies concerning cigarettes by basically replicating the studies, which is the definition of science, is to have replicable results, to replicate science. And the other is, of course, about the COVID-19. I was also featured in this article, although I haven't received any funding from anyone about my research on COVID-19, as I will explain later. Now, the escalation is coming from journalists, so non-scientists, who are using the scientific domain, so a medical journal, in order to write an article criticizing, supposedly, in quotes, basically, research. And this has happened to me, among others, in the latest BMJ featured article. So, what was my interaction with the investigative desk, which is the organization from where these journalists belong? I received an email from a journalist, member of the investigative desk, on November 20th, 2020. I responded within a few hours. So it was basically 1:30 a.m., if I remember well, on November 21st. And in my response, I explained, and you can see the date of my response and the time of my response, I explained that all my studies concerning COVID represent my own findings. They have nothing to do with the views of the laboratory. They were not funded by commercial entities. Basically, they were not funded by anyone. We didn't receive any funding from that. And I also informed them, since the questions were about my links and my work at the university, at the Laboratory of Immunology and Molecular Biology, that I don't receive any salary from the laboratory. Basically, I'm a non-paid external associate. I've never received not only a salary, but I've never received any kind of fee, remuneration or any other material from the laboratory. So I cannot be considered an employee of the laboratory. And of course, I'm not involved at all in any activities or cooperations or agreements between the laboratory and any entity, commercial, non-commercial, non-profit, for-profit, whatever. So my response is, of course, available online for everyone to see it. But now the issue is that I explained to them that all my work concerning the COVID-19 is about the cholinergic system. It has nothing to do with tobacco harm reduction, because they were trying to make some links between COVID-19 research work and tobacco harm reduction. I explained to them that there was no funding. It has nothing to do with e-cigarettes or any other product, basically. We didn't even mention the words e-cigarettes or tobacco harm reduction in any of my research work. We have several publications. We only talked about pharmaceutical nicotine products, but not only that, also other cholinergic agonists that act on alpha-7 nicotinic acetylcholine receptors, because this is what we are investigating, an interaction between the spike protein of SARS-CoV-2 and nicotinic cholinergic receptors, specifically the alpha-7 receptors. And this is exactly what I explained to them. And I also told them that we seeked funding from a pharmaceutical company which produces one of the approved cholinergic agonists. Of course, we didn't receive any funding, otherwise we would have declared any relevant funding. But I wanted to make clear that we sought to receive some funding from the pharmaceutical industry. They didn't care, obviously, about the pharmaceutical industry. Now, the result after this email interaction was 2 articles in news media, in Le Monde and in Argos VPRO. I mean, it's a broadcast in the Netherlands. I reacted by sending 3 letters to Le Monde, 1 letter to Argos. There was no response. There was one response from Argos, basically, which said that we don't see anything wrong. Although I explained all the issues, I also showed them the email that I had sent to one of the journalists of the investigative desk. Of course, there was no response, no correction, not even a reference to my arguments. For example, they never mentioned that I'm not an employee of the laboratory of the University of Patras, that I'm a non-paid external associate. And it's something that they could have verified independently very easily. They could have just asked the university or the laboratory to receive an official response whether I'm paid through a salary or through fees at any point in the past for my work there. It's very easy, they didn't have to believe me. They could just verify it, and, the burden of proof lies on the accuser, not on the accused. It would make no sense for myself to go and ask the university for a paper saying that I'm not paid by the university. It sounds funny. Interestingly, the Le Monde article had some changes over time, and it happened after I sent my second, if I remember well, letter. So initially there were 5 authors in the article, and that was a Web Archive document from December 19, the date it was released. And you see that there are 5 journalists mentioned, 4 of them members of the investigative desk. Interestingly enough, or incidentally, let's say, 4 of the journalists, all members of the investigative desk, were removed from the authors list in an update on January 24. And even now, you will see that there is only 1 author listed, although the investigative desk is mentioned as a participant in preparing this article. What else did I do? I submitted the Freedom of Information request to the University of Bath. asking for any contracts, memoranda of understanding, or other agreements between the university, Bloomberg Philanthropies, and the investigative desk. Why? Because in my original email, I told them, and it's mentioned in the email, that this kind of questioning reminds me of Bloomberg attempts and Bloomberg type of questioning, because I have received similar emails in the past. And I also mentioned, and you can see it online in my email response, that you didn't declare your funding. Well, in reality, even in their response, they didn't declare anything about the Bloomberg Foundation or even University of Bath. They just referred me to a link of their website, basically, showing their partners and donors, in which where the University of Bath was mentioned, and that's what triggered me in in submitting this Freedom of Information request. I received the documents on February 5, 2021. All documents have been released by me online. There are no persons named there, so I'm not violating any rights. And it's clear that the investigative desk has received funding from the University of Bath, and in reality from Bloomberg Philanthropies through the University of Bath. Here is one of the Freedom of Information Act documents, where it also says that while the Bloomberg Philanthropies are basically funding the investigative desk through the University of Bath, that the contractors should not make any public statement that they are directly funded by the foundation. Of course, technically they are not directly funding, but it looks strange. Of course, in all the documents, there is no reference on the funding amount or the purpose of the funding. So we don't know why they were funded, and we don't know how much money did they receive. Of course, we know pretty well the Bloomberg's contribution to science, which is basically non-existent. They don't produce any research. It's activism based on criticism of others who just publish studies which are, favorable to tobacco harm reduction. They're trying to find links, interactions, whatever you can imagine. In some cases, of course, there are funding. There is funding coming from industry or from other sources, but in many cases, it just isn't the case. But it seems that they don't care. They have this strategy of discrediting anyone who has something positive to say about tobacco harm reduction, whether it's electronic cigarettes or any other product. They are funding several organizations throughout the world, so they have basically a network of associates and sponsored organizations which are doing exactly this. They are trying to pinpoint people who are working together, and if someone has any conflict, then they try to make links between different people based on the conflicts of one or the other person. It's a well-known tactic, and I have been targeted, as I said in the past, by this, but I've never seen any scientific journal publishing anything like that. Now, coming back to the BMJ, it is very interesting to look at the BMJ conduct in this issue. So I was never contacted by the BMJ before the article from the journalist was published. It was published as a featured article. I submitted my response online immediately after I saw the article. Several times, more than 10 times. Nothing was ever published. I also contacted the editors through emails. I sent them all the documentation from the Freedom of Information Act request. I responded on the false allegations about conflicts. I requested to publish a response because you cannot have such an article left unanswered. They have not published my response yet. It's several days. Continuous attempts to submit responses. One lawyer, because one day I just sent them the response by email, and I said, You need to tell me what is your objection. You need to ask me to revise and explain to me why I should revise and what I should revise, and I will make a revision if I feel that this is reasonable. Well, one day I received a response which was basically a revision of my response done by a lawyer from the BMJ, and they wanted to publish this with my name as an author. Of course, I found that unacceptable, and I said I'm not going to accept censorship and revisions coming from the lawyers or the editors. You will have to ask me and explain to me which part should be revised and why. And in reality, what they did was remove all reference to the Freedom of Information Act documents, remove most of my arguments, like the fact that I'm not paid by the university. I mean, it's ridiculous. They even left references which were mentioned in the text, in parts of the text that they had removed. I mean, it was a very crappy job, and there was no way that I could accept such censorship and basically someone else to prepare a response which would be presented as my response. Impossible. They claim that they want to investigate my allegations against the authors. That's what that's the term they used. But of course, and it's more than obvious, that they didn't investigate any of the allegations against me made by the journalists. And while they want to investigate the issue, anyone would expect that they would retract the paper. Well, no, they didn't retract. Then they haven't retracted the article yet. So the article is left online, unanswered, with undisclosed conflicts of interest from the journalist side, and it's fine according to the BMJ. Everything is fine. So I had to publish my response in Chaos, and this is the third version, where I also mention the title, the undisclosed conflicts of the journalists, and also the BMJ as the journal where the article was published. So basically my response was in relation to conflicts relevant to the laboratory, that I'm a non-paid external associate. I have never received any salary or other fees or anything else from the laboratory. And I have never, of course, participated in any activities that were funded by commercial entities. They also mentioned two organizations in which the director of the lab is actively participating, the No Smoke team and the Patras Science Park, which are not part of the laboratory or the university, and with which I have no affiliation at all, no link, no cooperation. I've never even visited the facilities of the Patras Science Park. I mean, if they wanted to prove that, let's show us any documentation in which I'm mentioned. I'm not even mentioned there. I've never been there. I've never done any work there. They claim that my COVID-19 research is linked to tobacco harm reduction. That's how they present tobacco industry influence, which is, I mean, has no logic, because my research has nothing to do with tobacco harm reduction. And I've never mentioned tobacco harm reduction or any non-pharmaceutical product in any of my studies as having any potential role in COVID. I only talk about the cholinergic system and cholinergic agonists, that means pharmaceuticals. They say, of course, that my research is directly or indirectly supported by the industry, which there's no truth in that. None of my study was funded by anyone, commercial, non-commercial entity, anyone else. They mispresented the research. I mean, that's really impressive. They are journalists. They have no idea about science and statistics, obviously. So they took the results from OpenSafely, the results from the model adjusting only for age and sex, and they reported that, look at OpenSafely, it showed that smokers are 14% more likely to have COVID-related death, a higher risk for COVID-related death. Well, in reality, the fully adjusted model showed that smokers were 11% less likely to suffer from COVID-related death. But not only that, in my response, I present 11 studies, and that's not all the literature, 11 studies, including studies published in the BMJ or in journals of the members of the BMJ group, that not only verify, but even expand on my findings, because my main findings concerning smoking and COVID-19 refer to the underrepresentation of smokers among hospitalized patients with COVID-19. Well, there are many studies which show that smokers are less likely to be diagnosed with COVID-19. So there are studies which even expand on my research and my reports. Now, something that I didn't mention in my response, but I think at some point it makes no sense to go further into details. But in my original studies on COVID-19 and smoking and COVID-19 and the cholinergic system, I didn't even include anyone from the University of Patras. I didn't include the director of the laboratory. They were not interested in that. But the reason that I recruited them, once I saw that there may be an interaction between the COVID-19, the virus, and the cholinergic system, the main and only reason why I asked Professor Poulas to help me was because he is a nicotinic cholinergic receptor expert. His PhD thesis before e-cigarettes were invented was about cholinergic receptors. His most cited paper is a paper from 2007. He didn't even know that e-cigarettes existed in 2007, about nicotinic acetylcholine receptors. So he's an expert in the cholinergic system. He has worked all his life on cholinergic receptors long before e-cigarettes were invented. And that was the main reason why I asked for his help, and not only his help, but several others from other universities. We did in silico computational modeling studies. We've done quite a lot on this issue. But our research subject is COVID-19 and the cholinergic system, an interaction between the virus and alpha-7 acetylcholine receptors. Nothing more, nothing less, nothing about tobacco harm reduction. Completely irrelevant. And here is a short, let's say, list of 11 studies, mentioned all of them cited in my response in Chaos, fully verifying or even expanding on my findings. So in conclusion, the featured article in the BMJ is full of false allegations by the journalists, and this was intentional for two main reasons. First, they were already aware that their allegations were false through my response by email before they even authored the media articles, let alone the BMJ article. They could have independently verified my statement. They could have sent a question to the laboratory or to the university asking if I have ever been paid by them. And, as I said, the burden of proof lies on the accuser. They discuss about conflicts for COVID-19 studies which were not funded by anyone. Still today, we don't have funding for any of our research activities on COVID-19. Anyone. They mispresent my research on COVID-19 as being relevant or linked to tobacco harm reduction. I mean, I haven't mentioned tobacco harm reduction in any of my studies. They mispresent evidence from the Open Safely. I mean, that's really impressive. But not only that, they of course ignore a large list of studies which fully verify and expand on my findings. They mispresent basically the whole purpose and the aims of my research, which is about an interaction between SARS-CoV-2 and the cholinergic receptors, which generates the hypothesis that cholinergic agonists acting on alpha-7 receptors may be beneficial in preventing or treating COVID-19, and there are already clinical trials on that. And unfortunately, the BMJ conduct and its non-reaction basically raises serious questions about its publication standards. So that's a debate about tobacco harm reduction, which has nothing to do with science, because in the whole article in the BMJ or in all other media, they never questioned any of my studies in relation to the content, the methodology, the analysis, the presentation, and the interpretation of the results. Nothing about the content of my research. And this is sad, and it's even more concerning that they are using the scientific domain, so scientific journals, in order to publish these false allegations, and the journals do not react in an appropriate and expected way. The least they should have done is to retract the article until they properly investigate everything, not only the content of my response, which has never been published, but also the content of the journalist's article. It's really sad. I think I'm going to seek legal advice in this case. I can't let it go without any reaction. So I'm planning, hopefully, and depending on the cost, of course, because unfortunately I'm not rich, I plan to engage into, to exercise basically my legal rights against anyone who publishes such false and defamatory allegations. Thank you very much.